Hi, it's Devon here from Absolute Injury Management, Gippsland's Exercise and Sports Medicine Centre. We're talking thumbs today. We're talking about how you can best strap your thumb for ball and contact sports that can help you either protect an injury or avoid one completely. Stick around. Thumb injuries are common in sport. Think about those stinging injuries where you cop a ball on the end of the finger or the thumb. They hurt like hell. The other place in sport where you'll often injure your thumb is when you get it caught in somebody's jumper or outfit when you're trying to defend. And if you don't look after them or you don't do the right thing by them early, then often they'll hang around throughout the season and become a real issue. They can even affect your ball handling skills. And if you don't look after them, you can also sometimes damage the structures around the joint so that you may have to eventually have thumb surgery. If you want to avoid those things, get a good strapping technique and do the right thing outside of sport to make sure it will settle down. Let us show you how to best strap it right now. Okay, so with the thumb in sport, it'll generally get hit by a ball on the tip and it'll pull the thumb back too far into what we call hyperextension, or it'll get caught in a jumper or some uniform, and that will also just cause the thumb to get stretched too far back. So our taping method today is going to put the thumb in a slightly shorter position so we can protect it and stop it from getting back too far. So we're just going to start with some hypoallergenic tape just over the skin. And it won't play too much of a role other than to protect the skin itself from irritation. We'll just put a couple of small cuts in that tape as well, and that just often helps the tape to sit comfortably around the bottom of the wrist without significant creasing. And we don't want creases in our tape. We want the tape to be nice and flat. I'm also just going to put some of that hypoallergenic tape just over what we call the thenar eminence of the thumb. So that's an area where we're going to have a decent amount of tape. We're just going to then cover that under wrap with our standard 38mm strapping tape. Both over the wrist and over that thenar eminence. Okay, now from that point we need to put an anchor around the base or tip of the thumb. Now we want to make sure that we're above the joint. We don't want to get too close to the tip, but we also don't want to get too close to this particular joint. So we've got an anchor at the bottom and we've got an anchor at the top. Now what we're going to do is we're going to get the patient in a slightly shortened position. So they're going to bend that thumb slightly, and then we're going to put a few strips of tape just between those two anchor points. So we're going to put 3 strips in there today. Now I can fan those out a little bit, but they're designed to stop the joint from getting into hyperextension. So I can test that now. I can pin that strip of tape at both ends, and then when I try to straighten the patient's thumb, they should feel some tension and feel that the tape is restricting them, and that's exactly what I want. So now that I've got those anchors in there, I'm just going to put another small anchor just over the top of that thenar eminence, just to hold the bottom end of the tape. Now I'm not going to worry about that up the top here because we're going to cover it with some 25mm elastic adhesive. So we'll start with that just around the base of the wrist. Now we're going to come up around the thumb in a standard figure 8 style pattern. And what I'm looking for with that figure 8 style is I'm looking for a nice V down the line of the thumb. The other thing I need to be aware of is I want to be careful that I don't cut into this web space, because that's quite irritating. So I'm going to do 2 or 3 of those runarounds. Again, I'm trying to make sure I'm maintaining a good V pattern. For the last one, when I get up to the top, I'm just going to run just straight around the tip of the thumb. Again, I don't want to be too tight up here. I don't want to stop blood flow to the tip of that thumb. And then I'm just going to cut that off there. Now that elastic adhesive still has an edge that's going to come free if we don't do anything about it. So we're just going to cover that with one more anchor of 38mm rigid tape. I just want to make sure I don't get any creases in that last one, just to make it look nice and pretty. Now we can just test that thumb now if we want to. If we pull that back into hyperextension, hopefully the patient does report that they're feeling some degree of stability there. But that's your standard hyperextension thumb taping method. Okay, so that's what you need to do during games and training sessions. You need to block that hyperextension, and that will help limit the damage to that thumb. Now, what about outside of games? How do we get that thumb to settle down, and how do we let it heal? The best thing you can get your hands on is a short thumb spiker by Exos. That's a heat moldable thermoplastic that we mold and shape to your hand, and you can wear that through the night. You can wear that outside of sport and also outside of work, and that'll just help the thumb settle down, feel much better, and let the damage heal. If you want to learn more about Exos bracing, or you want to share or like this post, make sure you do tag your friends in it who have dodgy thumbs so that we can help them out as well. And any questions about anything that we do here at Absolute, give the clinic a call on 517-47250 or jump online at absoluteim.com.au. Thanks guys.